Assemblywoman Catalina Cruz, welcome to ITV Gold. Thank you for your time here.
Thank you for having me again. It's good to see you after such a long time.
Of course, of course. When we first had you, you were campaigning for this, and now you are the Assemblywoman, and you are taking us through such a hard time. Just starting this interview with us, I would just like for you to reflect upon how COVID-19 has impacted the immigrant communities. You represent District 39. It is super, super diverse. It has a lot of immigrant communities. A lot of essential workers are also working there. Could you tell us how it's impacted that minority community?
Absolutely. Look, in the 39th district, we have Jackson Heights, Corona, and Elmhurst, and Jackson Heights and Corona are actually statistically the top two neighborhoods with the highest number of contagion, as well as top two of the top 10 neighborhoods with the highest number of deaths because of COVID. What this has meant is that people have unfortunately died, people have gotten sick. We have to look at the history of the neighborhood to understand why that has happened. These are immigrant communities that are highly dependent on daily labor. So whether they're at a restaurant, whether they're domestic workers, whether they're street vendors, and lots of these folks have no access to healthcare, have no access to help from the federal government because maybe they're undocumented, or maybe they have another form of status, or we have lots of folks who are taxi drivers, who are Uber drivers, who are working in these industries where you're not necessarily considered an employee. So you may get some help, but not all the help that you need. And that has led to a lot of people ending up this way, sick, unfortunately. One of the other, I think, unique things about this neighborhood is we have some of the highest concentration of people. We are forced often to live in overcrowded situations because the rent is too high, and sometimes it's cultural. Sometimes we want to live with grandma, we want to live with auntie, but most of the time we're forced to live in overcrowded situations because we just can't afford the rent.
Definitely. And so, when I ask you a question about the impact on the healthcare system, then these communities are directly impacted by those. Wouldn't you say that?
I mean, absolutely. In this neighborhood, we have one big hospital. Well, in these three neighborhoods, we have one big hospital, which is Elmhurst Hospital. And many of your viewers may have heard that in the past 2-3 months, Elmhurst Hospital became almost like a daily thing on the news because of the number of people that were dying, because of how crowded it was, because it began operating at almost, I believe, 125% capacity, which is extremely high. And so the healthcare system almost crumbled in our neighborhoods.
Definitely. And then, discussing that, when you're looking at this economic crisis and the healthcare crisis, right now, what is the condition of the hospitals in your area right now in the district? What are the needs, of the hospitals and nursing homes? And I see there's a PPE supply and boxes of those behind you. I would like to know what that is for as well.
So I think it's much better than it was when it began. Initially, we weren't getting enough supplies. We didn't have the support, frankly, from the elected officials who needed to be worried about this. When people realized how terrible it was, we began advocating for more PPE. And so we were getting it from the government, but we were also getting it from donations, which is some of what you're seeing here. But this is actually not that. This is bags that we use to pack food for the people that we feed every day out of our office. Because one of the things that began happening is that we don't have food pantries in our community. So people were going hungry, and we closed down our office to the public, but we opened it up to give out food.
Is food insecurity a really big problem in that area right now due to the economic crisis and the healthcare crisis?
It's a huge issue because if you are doing the kind of work that you depend on it every day, as I mentioned before, if you don't work, you don't get paid. If you don't get paid, you don't eat, and you cannot pay rent. And so people are scavenging basically at different places to see where they can get food because there isn't a lot. So we partner up with nonprofits, our neighbors. We had a union drop off a bunch of food today. We are depending on the help of others to make sure that our community is not going to die hungry.
What are some of your current concerns, your major area of focuses right now? with reopening as such a major news, is a concern also a resurge of COVID-19 cases while your area is still battling with it?
Absolutely. I think it would be irresponsible for us to just open it up just like that. I think we need to, this I do agree with the governor, to do it gradually based on the statistics and the numbers that the healthcare professionals are giving us. If we begin to see a steady decrease in a way that it would make it safe for us to reopen, then that's what we need to do. But we still need to do it gradually and with education for the community so that we don't end up 3 months from now worse off.
What do you have to say about the local as well as state leadership here, especially in New York? We are the epicenter of the epicenter. How do you think all of these leaders have handled this, the city itself?
I think I think many of us have done a really good job at being at the forefront of what the community needed. But I do think that for a while there, some of the leaders at our city and state level spend too much time fighting each other rather than helping people and figuring out who could take credit for the work. And so we're at a point now where no one cares where it came from. No one cares who takes credit. All that people want to know is, can they pay the rent? Can they eat? Do they have health care? And when can they go back to work?
What is the answer to any of those questions, then, Assemblywoman? When are you predicting somewhat of a normal life in New York?
Never. We're never going to go back to the normal that we thought was the normal. And that's what I think people don't understand. For a long time, we prioritize the self rather than the community. For a long time, we chose politics over people. For a long time, we neglected the communities that needed us the most, while only remembering them during election time. And so I think we as a community will never be the same. I can make a prediction as to when we'll have a little bit of new normal, because I'm not a doctor or scientist. I think it's going to take a while for us to go out into the street without our mask, not feel the need to put hand sanitizers every 5 seconds on our hands, and for us to see a decrease in the rate of deaths that we have been seeing. And so it's we'll see.
The economic ramifications of COVID-19 is beyond the word massive, if I may say so.
Yes.
The amount of impact it's had on small businesses, especially in your district, is also pretty incredible. What do you have to say about the resources that are available through your office, or how should we as a society handle these economic ramifications of COVID-19?
Look, I think the complete ramifications are yet to be seen. We're not going to know for a while how really bad the businesses, small and large, are going to be hit by this pandemic. At our office, we're helping people connect with state, city, and federal resources, but the reality is there's not that many. Our society was not prepared in any way for what just happened. For thousands of people in a neighborhood losing their lives, for thousands of businesses closing, for the need of unemployment insurance. Like, people were just we were not prepared as government. And that's part of the problem. That, for example, at the city level, the money that was being given, it was first come, first served. And so it was at a federal level. And then that meant once the money was gone, because maybe a larger business came along and asked for that loan or grant, then a smaller business that really needed it didn't get to actually take advantage of it.
Wow. That's quite the ramifications. How do you foresee us resolving some of the economic crisis that the nation is facing right now?
I'm sorry, how do I foresee what?
Us resolving some of these economic issues in the next coming weeks, perhaps with reopening and other instances.
I don't know. I think that's the part of the bigger conversation. We're not going to know. It would be irresponsible for us to make some sort of assessment right now We
Right.
don't know if we're going to get a second wave. I mean, we're told that it's likely we're going to get a second wave, but we don't know how bad it is.
Right.
We don't really know when we're going to be able to reopen. We don't know how many people total are going to lose their jobs or their businesses. So I think it's unpredictable right now how bad is it really going to get.
You're also a huge advocate for justice and also for just getting your voices heard. In especially New York City, we've seen recently the crime rate, go on and increase. The rate of domestic violence is on an increase. Your comments on what's happening, especially with the immigrant community, the South Asian American community, in the center of this, and also the resources available through your office.
Look, I think unfortunately, during times of desperation, uh, people are going to resort to whatever they need to do in order to be able to eat, to survive. I think if we as government are really truly going to care for people, not only are we going to give them the resources that they need, but we're going to make sure that we're not unnecessarily sending somebody to jail. And so in our office, we can help folks apply for unemployment, for social safety net programs like food stamps, mental health services, and other things that they may need. And so I would rather them come to us before they get to the end of their rope and their line and end up resorting to stealing something or just engaging in an activity that could later on be detrimental to the things they want to build in their community.
For the next few weeks, Assemblywoman, what are you focused on?
I'm focusing on making sure that I continue to feed our community. So Monday through Friday, 12:30 to 3:30. If people are hungry, they can come and get a meal out of our office. When we have extra food, we give out extra food. We also give out vegetables once a week. And if people need diapers, formula, etc., we can also secure that for them. I'm focusing on making sure that the people who need to apply for unemployment not only apply, but actually get their money. And I have several pieces of legislation to address the needs of those who've lost a loved one, those who have been scammed, those who have who have a business and need options on what to do if they can no longer afford to stay open. So we're looking at different ways to help our community come through the other side of this crisis.
Assemblywoman, you just mentioned, the ones that have lost a loved one. I would like for you to just address that community that is grieving, that is still scared and is perhaps feeling that maybe things have been unfair to them. I would love for you to just give a word to them.
For those who've lost a loved one, you're not alone. Our sincere and deepest condolences. There are services to help you through that grief. You can contact our office, 718-458-5367. We can absolutely give you a referral. But the unfortunate part of all of this is that this is not over yet. More people probably are going to die. And that is why it's important that when we can manage to stay home because we don't have to go out to get food or anything else, that we just stay home as much as possible, and that if we have to go out, we wear a mask because it's not just for us, it's for those that we love and to protect them.
What is needed at the state level and at the local level in New York right now, according to you?
I think we need a better focus on how do we resolve the housing crisis, the overcrowding situation in a lot of the neighborhoods that became the epicenters. There's some in Brooklyn, there's some in the Bronx and us. How do we address that housing issue that led us here? Because I think housing is in big part a culprit of this. How do we make sure that undocumented folks who have been paying into our system for a very long time can get health care, unemployment, and other benefits and help? And how do we make sure that our businesses, when we are ready for them to reopen, can reopen up successfully?
I just have a few questions left here for you. One of the questions that is mostly asked by a lot of parents right now is this huge impact we've had on the education system. According to you, what is needed for the education system right now? How are we making sure that every New Yorker that needs education has access to it?
Look, I think that's more of a question for the Department of Education. My job is to advocate to ensure that every child has access to an electronic device so they can learn from home, and that when we're ready to reopen the schools, we are doing so in a way that keeps everybody healthy, teachers, principals, students, parents. We have to make sure that every child does have access to that, and that even if we're going through a pandemic, that they're able to get the best out of their education. That means more funding. That means rethinking if we need this much testing right now, and how is that going to work?
I just wanted you to give a message out to the frontliners, but also if you could address their needs, according to you, and perhaps how we can all help as a community, perhaps supporting your office or the frontliners.
Look, I think the one thing they need is our support to ensure that they are getting paid properly, that they're getting the PPE, the protective equipment that they need, that when this is over, we're taking care of their health and not just forgetting about any second hand repercussion that they might have. And we're just eternally grateful. There are people who ran toward this danger the minute they heard that our community needed it, and we're never going to be able to truly thank them and appreciate them for all they've done.
I'd love for you to give one last message to our audience, and again, thank you for your time here on ITV Gold.
Thank you. My hope is that that folks remember that this is going to take an entire community for us to really survive. That if you could afford to stay home, stay home. Take care of your family, and if you have to come out, make sure that you are taking all the precautions, 6 feet apart, face mask, wash your hands, don't touch your eyes, etc., etc. Just really take care of your family, and that if they need any help or support, they can absolutely call our office, and that number again is 718-458-5367.
Thank you again.